In this lecture, we're going to look at a number of different foodborne illnesses. We're going to pick out kind of some of the most popular ones, or the ones you're most likely to get if you don't employ some of the food safety practices or the food you eat hasn't undergone that. Keep in mind that this is not an exhaustive list. These are just kind of the big major ones, but just to get the idea across to you about some of the recurrent themes in helping to prevent these. So what are the foods that are most likely going to make you sick? Note that seafood is number one. And we're talking about raw and undercooked seafood and shellfish. You'll see that for so many of these different diseases, you get them from eating raw and undercooked seafood and shellfish. Okay? If it's cooked properly and handled properly, it's not going to make you sick. But notice that right after seafood comes produce. Okay? Produce, because it comes out of the ground, where there's a lot of potential pathogens, and a lot of times we don't cook it, so we're not going to kill those potential pathogens. If you don't wash it properly, can make you sick. And we've mentioned that sprouts are among the biggest culprits as far as produce that's going to make you sick goes, because sprouts, we tend not to wash them anywhere along the food chain. They come right out of the ground along with all that bacteria, and people don't wash sprouts because a washed sprout would be a soggy sprout. So unless you're absolutely sure about the safety of your sprouts, it's a pretty good idea to avoid them if they're raw. And most people don't eat cooked sprouts. And then after that, you see poultry and beef kind of tied. Again, that's if it's undercooked or not handled the right way. And lastly would be followed by eggs. Most of the eggs that you're going to eat from a commercial food service operation are now pasteurized shell eggs. Okay, most jurisdictions have rules that say you can't even buy eggs that aren't pasteurized anymore. They're pasteurized in the shell, so even if you cooked them and they weren't done all the way, they've already been pasteurized to kill, in many cases, what salmonella. Okay? If you're dealing with unpasteurized eggs and you have raw egg yolk, you do run the risk of getting salmonella, as we'll talk about today. Keep in mind that bacterial contamination can occur at lots of different points along the food chain. Okay, it could be the chickens standing in each other's fecal matter in the chicken house. Okay? It could be poor sanitation methods in the packing house. Okay? It could be inappropriate hygiene on the farm, or it could be not washing fruits and vegetables, not cooking foods to the right temps. There's lots of places where compromises can occur along the chain. And that's that program HACCP that helps to identify at each level where could the compromises occur and then what's being done to make sure that it doesn't. The first condition that we'll talk about is salmonella. This is the first type of foodborne illness, and it's caused by the salmonella bacteria. Now, salmonella is the most common type of foodborne illness in the U.S. And there's over 23,000 different types of salmonella bacteria. The primary sources are going to be raw and undercooked eggs, meat, poultry, produce, and unpasteurized milk and dairy. Unpasteurized milk is what you also hear referred to as raw milk. We'll talk about pasteurization in a little bit, but most of the milk that you buy in your conventional grocery store, the good majority of it is pasteurized in order to kill potentially harmful pathogens. It will usually take you about 1 to 3 days after ingesting something with high levels of salmonella in it until you get sick. And the signs that you have salmonella are going to be very similar to lots of foodborne illnesses: nausea and vomiting, abdominal cramps, diarrhea. It lasts 4 to 7 days, and it can be fatal. Okay, but if you have a strong immune system or low doses, you're probably not going to die from it, although know that you could. So the ways that we prevent salmonella are to pasteurize our milks and juices, cook eggs and meat products thoroughly, and then wash your produce, and of course always wash your hands. The next foodborne illness is called Campylobacter. Okay, and this is Campylobacter jejuni. Campylobacter is the name of the bacteria. It's a leading cause of acute bacterial diarrhea in developed countries. The sources are very similar: raw and undercooked poultry, unpasteurized milk, and contaminated water. The big difference with salmonella is it tends to be from the raw egg yolks if they're not pasteurized. This one's going to take you 2 to 5 days until you get sick, but you'll get sick with things like diarrhea, vomiting, bloody stools, and will last anywhere from 2 to 10 days. Okay. Campylobacter grows slowly or not at all in cold temps, so keeping your cold foods cold. And it's killed by heat, so your hot foods hot. As long as you're carefully storing and thoroughly cooking your foods, you're not going to get Campylobacter. The next one is one you've probably heard of, which is E. coli. Okay? It's caused by the Escherichia coli bacteria. And a particularly virulent strain is what's called O157H7. Okay, and O157H7 is the strain of E. coli bacteria that's become so problematic in the U.S. and it's so fatal. We tend to see it among raw and undercooked hamburger products, which are ground beef products. Again, if you have a steak and on the outside there's E. coli, if you put that steak on the grill and cook it on either side, even if it's just for a minute or two, you're going to kill the E. coli. But if there's E. coli on a steak and you grind it up into ground meat to make a hamburger out of it, you've now pushed the bacteria from the outside into the middle of the hamburger. And if you do not cook that hamburger to 160 degrees internal, in the middle of it, you potentially run the risk of getting E. coli. Okay. E. coli, there's some strains that are harmless, but there's other ones that are fatal. Oftentimes the sources are fecal contamination of water and food. You get solid waste products from other animals or humans that contaminates your food supply. It's not cooked properly. You ingest it. 1 to 8 days later, you get sick. Okay. E. coli O157H7 produces a toxin that causes abdominal pain, bloody diarrhea, and then fatal kidney disease. You see that especially in the children who, when there were a number of different E. coli hamburger outbreaks, they were the most susceptible. The parents ate the same hamburgers and didn't die from them. But the kids, because they were so small, and as a proportion of their body weight, that toxin was so large, it ended up killing them. The best prevention against E. coli is to cook your ground beef thoroughly and to only have pasteurized milks and juices. Okay. Let's say you have an apple tree, okay, and the apple falls off of the orchard onto the ground, and there's cow poop on the ground that has E. coli in it. If you grind up that apple and make a juice out of it, but the juice is not pasteurized, meaning the juice is not heated to a certain temperature, then what happens is that E. coli makes its way into your juice and ends up causing E. coli. So that's why we always encourage drinking pasteurized juice products only. This is just showing you the contamination issues. Again, just driving home the issue that it's the ground beef products, or any ground meat for that matter. If they're not cooked to 160 internally, the bacteria can be pushed to the middle of the ground product. But it's perfectly safe to eat a very, very rare steak if the steak has been seared and cooked on all sides on the outside, because the E. coli can't get into the middle unless you grind it up. Another foodborne illness is called listeria. The source of listeria is the Listeria monocytogenes bacteria. This one is really, really a problem for pregnant women. Okay, so listeria is differentiated in the sense that you hear sometimes those recommendations about things that pregnant women shouldn't eat, things like deli meats or hot dogs unless they're heated to steaming. They shouldn't have unpasteurized cheeses or soft cheeses like panela or queso fresco or some of the different Mexican cheeses. Okay, listeria, even in small amounts, can cause spontaneous abortion and stillbirths. It's anywhere between 1 to 21 days latency period. It's part of the reason why the education about nutrition for pregnant women is really focused on food safety. It's to help prevent listeria infection. If you're not pregnant and you have a strong immune system and you eat a little bit of listeria in turkey meat, it's not going to be a problem. Pregnant women are particularly susceptible. Another foodborne illness is called Clostridium perfringens. Okay, and we call this one the cafeteria germ. So listeria is kind of germane to the pregnant population. Perfringens is the cafeteria germ. Okay, what happens is in the middle of, let's say, a big dish of chicken pot pie that you're serving as a casserole, very little oxygen gets to the center of that large containers. And if it's not kept at the right temperature, it becomes just the perfect temp to provide a growth environment for certain bacteria that thrive in low oxygen conditions. Okay, those bacteria will form heat-resistant spores. So for meat that's stored, let's say, on a steam table at somewhere between 120 or 130 degrees Fahrenheit, which is in the danger zone, because remember the danger zone is 40 to 140, okay, that's where the perfringens could proliferate. And somewhere 8 to 16 hours after eating that food, you would become ill with things like vomiting that might last you 1 to 2 days. Botulism is an example of a foodborne intoxication. Okay, the bacteria called Clostridium botulinum, when you ingest it, also forms spores, and the spores in turn are what are going to make you sick, anywhere from 4 to 36 hours after ingesting. The signs of botulism, it's neurological in nature. Okay, it affects your nervous system. Remember, most of these affect your gut, so this is different in the sense that it's affecting your nervous system, causing double vision, paralysis, and leading to things like respiratory failure. Botulism is the deadliest of all the bacterial food toxins. Okay? The sources include things like soil, water, the guts of other animals, and they produce a toxin that when heat-resistant spores proliferate because they're grown in low oxygen, low acid conditions. Botulism is what you're likely to find if foods have been improperly canned. So if you've ever canned certain meats or tomatoes, there's very specific measures that you have to undertake for sterilization and canning to make sure that you don't introduce just enough oxygen that allows the botulism and their toxins then to proliferate. Infants should not be given honey. Okay, so less than 1 year of age, we do not feed raw honey to infants because honey may contain the spores of Clostridium botulinum, which is a common source of infection for infants. So there's infant botulism. You and I as adults, those very, very low doses are not going to be problematic for us. But honey can be problematic for infants, and as such, we don't give it to kids under age 1. Another example of a foodborne intoxication is Staph aureus. Staph aureus will affect you anywhere from 1 to 6 hours after eating, so a little bit shorter time frame than some of the other ones, causing things like diarrhea, abdominal cramps, nausea, vomiting, and will last anywhere from 1 to 2 days. Okay, staph is prolific in your environment. You've got it everywhere, on your desk, in your hands, in your nose. Okay, but it's particularly harmful when it's produced from the toxin that it produced if meats are improperly refrigerated, or if you have salads like potato salad or macaroni salad. Maybe you've heard that kind of going to a picnic and eating foods that have been sitting out in the sun, especially if they're mayonnaise-based salads like potato salad or macaroni salad, you're at much, much higher risk for getting sick from there. It's unlikely that they've got all those salads on ice and are keeping them at less than 40 degrees Fahrenheit. How can you prevent getting Staph aureus? You cook your foods thoroughly, proper food handling and refrigeration methods, kind of the way you do all the other ones. Viruses are a little bit different, but they can still make you sick. They're not classified as living or as cells since they don't reproduce on their own. Human viruses reproduce only inside human cells. Okay, but viruses can turn human cells into virus-producing factories. Okay, and viruses can spread very quickly from humans or animals and each other. So viruses that cause human diseases cannot grow and reproduce in foods, but infected people can make other people sick, as you'll see. Okay, here's how a viral infection can play out with regards to food. In step 1, a food like a raw oyster. Remember, raw or undercooked seafood or shellfish is the #1 culprit of foodborne illness. If it's contaminated with a virus and you eat that oyster, moving on to step 2, the virus will travel through your GI tract and attach itself to the lining of your intestines. In step 3, the virus will transfer its genetic material into the intestinal mucosal cells, so the cells of your intestine. In step 4, the virus uses the cell's metabolic machinery to make new virus particles. And in step 5, the infected intestinal cells are damaged or killed and release copies of the virus, which infect more cells of the intestine's lining. So an example of a virus that can make you sick that ties into food is what's called Hep A virus or hepatitis A virus. It's usually caused by either eating raw or undercooked shellfish or produce, or drinking water that's been contaminated with fecal matter, or more often than not, it's from a food service worker who hasn't washed their hands properly. If you've worked in the food service environment or the healthcare environment, you almost certainly have had to have a Hep A vaccine. But still, there's people who get into our system who haven't had this and could be proliferating this. It takes about 15 to 20 days after you've come into contact with the virus before you get sick. So think how hard a Hep A virus outbreak is to begin to track, so you can't remember where you were or what you did 15 to 20 days ago. As with all types of hepatitis, the signs include things like liver inflammation, jaundice, fever, nausea, fatigue, and abdominal pain. It may require months to recover, but usually Hep A does not cause permanent liver damage. How do you prevent it? If you're traveling, okay, if the water's not filtered and boiled, you should chlorinate the water, but you should also cook your foods thoroughly. And then, of course, we want to test and make sure that food handlers are not carriers. Another virus that gets a lot of attention is called norovirus. This is what we sometimes call the cruise ship virus. Okay? And that's because if you ever hear in the news about cruise ships where a whole bunch of people got foodborne illness, it tends to be norovirus. Because norovirus travels very, very quickly in environments where lots of people are kind of on top of each other. So in college dorms, norovirus can spread really rapidly. You also see it like in hospitals and nursing homes, lots of people living in close environments, just like the cruise ship travels very quickly. Usually caused by a contaminated handler, but also raw produce, seafood, shellfish, things like dorm rooms, and cruise ships tend to be the locations where these will occur. And it's really hard to get rid of. You have to basically pull the ship over, get everyone off, sterilize the whole thing top to bottom. Pull everyone out of the dorm, strip everything down, clean everything top to bottom. Empty the whole nursing room or hospital wing, get all those people out of there, clean everything top to bottom. Very hard to get rid of. Causes watery diarrhea, nausea and vomiting, abdominal cramps. Not fatal, but in older people in a nursing home or someone like a cancer patient, it could be. But your typical person on a cruise ship, they're going to get diarrhea for a couple of days, have to cut their vacation short, usually because they have to swap out the ship, because you can't just fix it in a day. There are certain types of molds and fungus that can make you sick as well. Okay, they grow on foods like bread, cheese, and fruit. Okay, under certain conditions, molds can produce toxins. There's over 250 different types of mold toxins. Okay, so cooking and freezing stop mold growth, but it doesn't necessarily destroy the toxins that were already produced. If your food is moldy, discard it, clean the area where it was stored, and check the neighboring foods to see if they're contaminated. Okay, so you've heard the phrase that one bad apple spoils the bunch. You have a fruit basket and you have a piece of moldy fruit. If it's touched other fruit around it, you should really throw that fruit away as well, or certainly wash it very well, peel away that area before you eat the actual fruit. Parasites can make you sick too. Okay, parasites are organisms that live at the expense of others. We've got some microscopic single-celled animals, whereas others are worms that are large enough to be seen with the naked eye. Parasites are killed through cooking, but you're most likely to get parasites from eating raw and undercooked fish. Okay? Parasitic infections can be avoided by eating fish that has been frozen, okay, except a lot of the fish that we eat in our environment today is frozen. So that's not really the best recommendation. The best recommendation is to really avoid raw and undercooked shellfish and seafood. Giardia is an example of a single-celled parasite. Okay, and this is what causes what you sometimes hear referred to as Montezuma's revenge. Okay, if you've ever maybe traveled to Mexico, Montezuma's revenge. If you ever traveled to Mexico and gotten what they call sometimes traveler's diarrhea, okay, it's because there's a lot of Giardia in the water in other countries, especially if their municipal water supplies are not as safe as the U.S. Okay, so drinking untreated water from streams contaminated with animal feces. Okay. Also in daycare centers where there's a lot of diapers being changed, and if the handlers are not washing their hands properly or the surfaces are not thoroughly washed, then that could proliferate Giardia. Okay, again, that is a parasite, tends to affect travelers more often than not.
Was that what they had on that one case where they had all those, I guess it was the fish came from China or something like this, that they had the chickens or the ducks or whatever was above it? And
so the question is if animals are stored at different levels, that came from China. Giardia tends to be more waterborne. It usually tends not to be from protein foods. It's what you're going to get. It's why you don't drink drinks with ice cubes in them in Mexico. It's made with dirty water with Giardia in it that melts and causes you to become ill. Trichinosis is an example of a multicellular parasite, okay, and it's called the Trichinella spiralis. Okay, trichinosis you might associate with raw and undercooked pork. Okay, but you should know that in the United States there are very, very few documented cases of trichinosis. Even if you eat super duper raw pork, which you shouldn't, okay, there's less than 40 cases per year. Our meat supply is extremely safe, okay, compared to what it used to be or what it might be in other countries. Once ingested, this parasite finds its ways to your muscles and grows there, causing flu-like symptoms. Okay, so again, it could be caused by raw and undercooked pork and things like game meats and fish, although it's extremely rare in the United States. You should still cook your meats to the appropriate internal cook temp to avoid lots of other things, but you're probably not going to get trichinosis. There's also a couple prion diseases that we'll finish up with today. Okay, prion diseases are pathogenic proteins that cause degenerative brain diseases like spongiform encephalopathies. That's the enlarging of the brain. Okay, prions stand for proteinaceous infectious particles. And two examples of these are BSE, bovine spongiform encephalopathy, okay, mad cow disease, a deadly neurodegenerative disease in cattle, and then VCJD. And CJD stands for Creutzfeldt-Jakob disease. This is human BSE. It's caused from eating things like brain, nervous tissue, intestines, the eyes, or the tonsils from a cow that was infected with BSE. Okay, the primary method of prevention and why these are extremely rare in the United States is because the majority of states and food service operations do not allow cattle to eat other dead parts of cattle. Okay, that used to be commonplace. As part of the feed you would feed to an animal would be parts of dead parts of other animals. Now, for the most part, do not allow that in order to prevent the spread of BSE. Here's how prions work. Okay, in step 1, a normal prion protein is present in your brain, or in the animal's brain. Abnormal prion proteins arise spontaneously or they enter from the diet if you ate the animal that already had this prion in it. In step 3, the normal and the abnormal prion proteins come into contact with each other. In step 4, the normal prions are converted into abnormal prions. And in step 5, the abnormal prion proteins accumulate in the brain, leading to the formation of plaques that damage the brain tissue. So in summary, there's a number of different ways that you could potentially get sick from your food. You could eat food that has bacteria and the bacteria make you sick. Or you can eat food that have bacteria that make spores and toxins that make you sick. Okay. There are two types of viruses, Hep A and norovirus, that potentially could cause foodborne illness. Parasites, prion diseases, and molds and fungus. Okay, but if you follow the 4 basic tenets, which is to cook, separate, clean, and chill, okay, at your home you can ensure food safety. And then, of course, you want to follow some of the basic precautions as far as producing food and where you eat food to make sure that you're eating at and buying from places that are also following these same food safety mechanisms.